Good morning to everybody in the United States who's logged on to this webinar, and good afternoon, good evening to everybody else from other parts of the world. I welcome you to this webinar where we are going to be looking at recent advances in the management of autism, cerebral palsy, and various other neurological disorders for which there was earlier no cure. At the outset, I'd like to thank Autism We Care for arranging this webinar. This has been arranged at the request of Autism We Care, and I want to thank all the members of Autism We Care for making this webinar happen. What we're going to do today is we're going to have a complete new look at neurodevelopmental disorders and other neurological conditions, because we've all been told that for autism, for cerebral palsy, for intellectual disability, there is no cure, there is no solution, there is no therapy. But all that has changed. There are new therapies available which can completely change the entire way in which autism is managed. And there are different treatments. We all are used to the rehabilitation, but now there's cellular therapy and there's integrative therapy. And this combination together is what will help our children. So what we'll do is we will start with um, a movie, a small movie on a child with autism who's from the United States. His father is a doctor, cardiologist, mother is a nurse. And in this very short film, we will understand, because as parents, you will connect with this. As parents, you will connect with the, the difficulties and the challenges that come once our child is diagnosed with autism or any other neurodevelopmental disorder. How they found out about stem cell therapy, how the therapy was done, and how this child has improved. This is a real life story, and this will give you a sense of what we are planning to do. So a short movie, and then I'll begin my presentation. With this, I'd like to welcome all of you to this webinar.
He was screaming, he was crying. I was trying to hold him, and we were like 45, 50 people on that bus. And it was 2.5 hours drive each way on the excursion. So on the way back, this woman just let it go. Would you shut up? I felt like a bullet went through me. I just thought, wow. I was like, oh, and I just said, my son's autistic. He can't help it. He really can't help it. And then you could hear a pin drop. Ganesh was born in December of 2003. We were so excited about his birth, and we had lots of family there and friends there. It was just delightful. He was very responsive, very happy baby.
We knew he was extremely spoiled. He always wanted to have his way. He was the apple of their eyes.
Snipe.
About 1.5 years old. He was a fluent reader.
Singing a song all day long. Oh.
He knew the alphabet and he knew the sound.
Yeah.
There were some things about him that were kind of extraordinary.
He was sitting on the kitchen floor, and I was doing dishes in the kitchen, and I just kept saying to him, Ganesh. I kept calling his name, and he would not look at me, which was very different for him. I couldn't get him to engage with me. I couldn't get him to give me eye contact. And we noticed over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes. look at the wall and be talking to the wall. Or he had problems with eye contact. He'd never look you straight in the eye. He'd look like that. His speech was not very fluent. So he would say, "Oh, cheese." He'd get the last part of it right, but not the whole part of it. He had problems with his speech.
He wouldn't even allow us to put the food in his mouth, and he would just be screaming and get away from me and stop hurting me. We were just chasing him with food constantly. We would get some of the other kids and we would corner Ganesh and we would force feed him. And it would be painful to do, kind of seemed cruel as a parent, but we knew that if we didn't have him eat something, then he would have just this huge tantrum and we all would be just horrified.
When he was 5, he was in school and his teacher asked him to do something and he didn't want to do it, and he had to have his way and the teacher wouldn't let him, so he ran across the room and kicked her. And that's when she called and said she couldn't take care of him, that there was something wrong, to get him checked.
Child psychologists insisted that Ganesh was not autistic. I suspected they didn't have a real accurate assessment of him. And I remember that doctor saying, "Oh, no, you don't have to hire a speech therapist." And I said, yes. I feel like I need to. He's lost so much vocabulary and I don't understand why. So when she came in, I did not know her. She didn't know any of us. And for the first 15 minutes, her eyes were just big and she kept watching Ganesh and she kept asking me, "How long's he been doing this? And how long's he been doing that?" And, Ganesh was, getting up every 2 seconds and running around and not wanting to do what she had asked him to do and not wanting to engage at all. The speech therapist said, "You have to know. You have to know your child is autistic." I closed my eyes and I just saw like a million bricks falling on my head. I just felt like that was the worst thing she could have said. Everything that she had said was exactly the behaviors that we had been seeing, but we were just dismissing. We didn't want to see, we didn't want to, I guess, to think of our son as being, autistic.
I did a lot of research, did a lot of studying on the internet and books, and there's no treatment, as we know, and we have to figure out a way to help him out. We tried homeopathy, and I tried it for about 3 months and I couldn't tell a difference.
We got him started on all kinds of supplements. We kept him on a gluten-free, casein-free diet, occupational therapy, speech therapy. I started art therapy with him. We did music therapy with him.
All of that seemed to help some. It seemed to calm him down some, but it wasn't making the problem go away. And the problem was he could not attend to things. He didn't have eye contact. He didn't have attention span.
We were just so frustrated because he didn't seem to be making progress.
Did some research and found out about stem cells being done in Mexico and Panama. I wasn't too keen on doing it because they take cord blood from a newborn and inject it IV into your child, and you don't know what you might be getting into.
We hadn't read too much about stem cell treatment. This was another one of those therapies that someone had sold us on. It was a lot of work, and perhaps we would be let down again. So I was really worried about that.
And that's when I found out about NeuroGen. And I spoke to Dr. Sharma. There was sometime in April of 2015. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
They were so polite and so kind and gave us lots of information. So we decided to try it.
Ganesh had some hesitation about coming to India and going to a hospital in India. The hospital is entirely built to American standards.
Our experience was positive. We were treated like family. We were treated so beautifully. Everyone was looking out for Ganesh. He would wander off, or he would do something quirky, and they were accepting, they were loving, they were embracing him for who he was.
The first stem cell treatment was December 2015.
I think as a mother, when you hand your child over, you have to trust someone with your child. You know, we handed them over for the stem cell treatment that morning. That real concern, that real worry, am I doing the right thing? The time that the procedure started to the time that it was over, things were okay, the way it was supposed to go. And it was just like so comforting. The neuropathologist came to the room. She had done the stem cell count. She said, I want you to know it was great. She said that the count was superb. And she said, you know, everything went without a flaw.
Procedure itself was painless. The recovery was simple, straightforward. We didn't have any problems.
You know, what's really neat about the NeuroGen is that they really put very necessary emphasis on therapies that you have to have in place.
You want to do stem cell, but you also want to do occupation therapy, physical therapy, speech therapy, behavior therapy to get the child back into the mainstream.
Good!
We started seeing better eye contact, definitely a difference in his engagement with us, with his siblings. Teachers were commenting, well, we can tell a little bit of a difference in Ganesh and what's new, and do you think this is the stem cell treatment? And we were like, that's the only thing we can attribute it to. And then things just gradually seemed to improve overall. His mood, he was so much calmer. There weren't these horrible, horrific tantrums. They were decreasing, and when he would have a tantrum, I could talk him out of it. We could engage with him, and we could problem solve. He was able to sit at the table with us. He was trying new and different foods, put the food in his own mouth and do it consistently. As a parent, it was very exciting. He loves popcorn. He really enjoys to make it himself now, which is new. It's a big thing for him. Of course, we're delighted for him.
Very nice. I like how you did that.
Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. It's very exciting. Because of his sensory issues, he could never wear anything besides shorts and a short sleeve t-shirt. So now he's able to wear long pants, which is cool. And he's gone from only wearing Crocs to now he'll wear tennis shoes. It was always a joke that he'd go outside and he'd just take all his clothes off. It wouldn't matter who was in the house, who wasn't in the house. It wouldn't matter who was outside. But now that's not the case.
Can you speak some languages?
Yeah, different languages, and
Like? Tell them.
like Hindi, Tamil, Arabic.
How do you say Hello, good morning in Spanish.
Hola, ¿cómo estás?
It was refreshing. It was exciting. We were seeing new and different things all the time. So it's almost like that window of opportunity reopened for Ganesh. And Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
This is the first time since his stem cell that he has gone to a regular school.
After ABS last year, I started going to green, and then I will do a good job in green.
It was as smooth as silk. He started day 1. He followed his schedule with help from the teacher. He learned his schedule from the first day. For this first report card, it was all A's. He's doing all the work. He's pleasant. He's correcting his errors. He's learning from the mistakes, like on the reviews, and getting the answers on the test questions with like 90% accuracy, which is amazing. He would get off the bus by himself. He did not want me to come down and meet him. He walked 2 blocks home and he would come inside the house.
I would like to ride the bus home and ride the bus back. I don't ride back to school.
These things seem minuscule to some people, but to us, it was a huge victory.
Every time he goes someplace, to his grandparents, to school, to wherever, people say, oh, he's a different child now. He's a lot calmer. He's talking normally, and he looks like he's grown up.
So he was taking a musical class. He was playing 4 instruments with a group. And then they had a recital. It was amazing. We chose to come back to NeuroGen for the 6-month follow-up. And we saw the PET scan images. I can't tell you the word, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. So my husband's board certified in nuclear medicine. So as soon as he saw the images, he knew, and he's like, come here, you have to see this. So that moment will always be, a memorable moment, because we had that validation, like this was worth it. I would thank NeuroGen a lot for their service, for them persevering, because it is new. It's a new opportunity, and because the research is building. But I appreciate that they are so driven and they're so ambitious for these individuals. They seem so dedicated to that patient. Dr. Sharma had mentioned once, he said, I have asked my staff to treat everyone as if they're my family. And I feel like that is truly what they've done. People think back in America, how could medicine be as good or better in India? When you're here, when you understand, when you're around and when you read and when you know, I've really grown to know and appreciate the caliber of medicine here is by far, it's loving. Here, they're more private perhaps, they're more individualized. We don't have those options there.
NeuroGen is awesome. The staff's awesome. Dr. Sharma is awesome. Dr. Nandini, everybody's awesome. We love NeuroGen.
I want to thank NeuroGen for giving me the last stem cell. Thank you.
Words of wisdom for parents who have a child that has been diagnosed as being on the spectrum is very simple, very straightforward. Get evaluated for stem cell therapy. This offers the potential for a cure. There's not anything out there that comes even close. I have seen a dramatic improvement both clinically and on the PET CT on my child, and it's unmistakable. It has been a game changer.
President Trump, You are a good president. What I like about you, President DT, make America greatest again. You're awesome.
He was always adamant about Donald Trump should be president of the United States.
Yes, I want to meet Donald Trump.
Ganesh is absolutely a delight to be around. I learn something from him every single day. The biggest thing that I've learned from him is it's hard to take adversity and turn it around to something that's positive and bring something of joy out of it.
Just wants to be happy, and he's so much happier within his own skin. And he can say that. He'll say, Mom, I love you. And those words had never been out of his mouth before. In Ohio, places where I can take my child and be myself and be a family and be accepted. We go to dinner and people come over and say, you know, I love that you bring your son to a restaurant. And that to me means so much, because when you're so tempted to stay at home, you're so tempted to just hide and not show the pain, not show that he's so different. I want him to be independent, of course, and as a mother, I would love him when his wings are ready, we can fly, but always be my baby boy, always.
We are going to be today talking about recent advances, what's new in the field of autism and cerebral palsy and other neurological conditions. So I present this work on behalf of the NeuroGen Brain and Spine Institute. I'm also professor and head of department at the medical school in the city of Mumbai. And, this comes to you with a hand of friendship from between our two countries. We have very, very close historic relationship, and it's important that we share our knowledge, our wisdom, our clinical experience together for the benefit of both. I'd like to make a disclaimer that this presentation is for information purposes only. It is not a substitute for a medical consultation for which you need to consult your local doctor. I'd like to once again acknowledge Autism We Care and the parents in the United States who have invited us to make this presentation for them. So why are we all here? We're all here because we have in our families children with special needs or other children, adults with neurological problems. And we have been from pillar to post. We've gone from doctor to doctor only to be told nothing can be done for your child, that, you have to accept life the way it is, and that, their damage cannot be reversed, and that rehabilitation is the only thing available. And I'm here to tell you that that is no longer true. So the current situation is that, you have been told there's no cure, you have been told there's no surgery that can help, that only rehabilitation, and that there are no medicines available. So what is available now? So up to now, we had only what you see in the center, rehab. But now we have something called cellular therapy. It's a new type of treatment. And we have integrative therapies, which have been available in the past. But this combination of cell therapy, rehabilitation, and integrative therapies, this is the combination. And that can actually reverse autism. Yes, you heard me correctly. It can reverse autism. We have treated now almost 10,000 patients of different neurological conditions, and what was earlier believed to be incurable can now be cured, but with this combination. So I show you this X-ray on the left-hand side. You see this is an X-ray of a broken bone. This is the leg bone, and you can see both the bones are broken here. And I ask you a fundamental question. If our child were to have a fracture of the leg like this, would you give rehabilitation on this broken bone? Would any of us? Obviously, we would not. What would we do? We would take our child to an orthopedic doctor, and he would, like you see in this X-ray, put plates and screws and fix the fracture. And then we will give rehabilitation. But in children with neurological problems, This is exactly what we are doing. Now, here's a scan of a brain where the blue part is the damaged part, and we are giving rehabilitation on this damaged brain. All right. Obviously, we don't get results because the brain is damaged. It's incapable of doing what you want it to do. What if we could repair the brain, like you see on this side, where there was no functioning, the green is functioning. What if we could repair the brain and now give rehabilitation? Would or would we not get better results? The answer is obviously yes. And I'm here to tell you that damage of this is possible. Repair of this damage is possible. So the older thinking was that once the central nervous system is damaged, it is incapable of repair. This is no longer true. This was old thinking. It's 150-year-old thinking that the brain is damaged, nothing can be done. But the new thinking is some amount of regeneration, some amount of repair is possible by what is called cellular replacement. So this is the new thinking. I'd like to, before I proceed, I'd like to show you a clip from a movie called The Accountant. I like this clip because it tells us something very fundamental. What happens is that when our children have any other medical problem, we look at a child as a normal child who has a medical problem. But when a child has autism or cerebral palsy or any brain problem, we think there's a problem in the child. We look at our child as less than. And in this very nice, very eloquent clip from the movie, it says our children are not less than, they are different. And this is very important. Before treating our children, we have to treat ourselves as parents. We have to view our children, our special needs children, not as less than, but as different. Let's watch this small clip. So I call cell therapy an idea whose time has come. And what I'm here to do is to shift you from a state of hopelessness to one of hope. The word stem, we are going to talk about stem cell therapy, comes from the stem of a tree. And just like the stem of a tree, gives rise to leaves and branches, fruits, etc. So like a stem, it will give rise to branches, leaves, fruits, etc. There are some cells which give rise to all cells in the body. These cells, which can give rise to a brain cell, a muscle cell, a blood cell, these cells are called stem cells. So a stem cell is one which can become any cell of the body. Now, stem cells are broadly of two types. You can get stem cells from the body itself, from our own body, from our own child's body, and put them back in the child. This is called autologous. You take from one part of the body, put it back into the other. There is something called allogenic, where you take cells from outside, from somebody else, preserved cells, and then you put them in our child or in our patient. So they're broadly speaking two: autologous, taken from cells, allogenic, taken from the outside. So stem cells have the ability to repair, to replace and regenerate cells. That's their main ability. They replace and so they regenerate cells. In the next, I'm going to show you a small clip from a TV series run by Stephen Hawking. We all must be aware of Stephen Hawking. Stephen Hawking is considered to be one of the greatest scientists who's ever lived on the planet, along with the likes of Einstein and Newton. And he had a special interest in stem cells because he was suffering from a disease called motor neuron disease, for which there was no cure except stem cells. And in fact, we are treating that disease with stem cells. And so he did a 12-part TV series on stem cells. And this is what he thought of stem cells. So how do stem cells work? The first quality of stem cells is that they have the ability to multiply. So if you have a single stem cell, you can make a couple of thousand or even a couple of million stem cells from a single stem cell. So they multiply. Secondly, they have the ability to convert. So if you have a single stem cell, you can make it into a brain, into a heart, into a muscle, into blood, into whatever you want. So that's the beauty of the stem cell. Not only does the stem cell multiply, but it becomes what we want. So we can make it into a muscle or a brain. So this is literally like creating an organ in the laboratory and then putting it back in the body. So that's the other special quality of stem cells, their conversion. And this is a slide from our own research. This is not from the internet or from a book. Before we started doing, I went to America to learn stem cells in 1998. From 1998 to 2008, 10 years, we worked in the laboratory, growing cells, growing stem cells, culturing them, trying to understand them. It's only from 2008 onwards that we started working with people and started treating people. So as part of our original research, this is what a stem cell looks like. And we showed that these convert, can you see these? That, at the end of 2 months, these have converted into neurons, these are neurons, nerve-like cells. So we first proved that a stem cell can convert into a brain cell and that these cells communicate with each other. Stem cells also release certain positive chemicals in the body. These are called growth factors, and they have a positive healing effect. The medical word for this is paracrine effect, where positive chemicals are released by stem cells. They also improve the blood supply to the brain. So you can see there's less blood supply. When the stem cells go, they attract blood towards it. So this is just a technical slide which shows all the things that stem cells do, from modulating the immune system, preventing cell death, etc. So on a lighter note, let me share with you. In 1990, I became a neurosurgeon at 1990. If I wanted to see the time, I needed a watch. If I want to take a still picture, I need a camera. For video, I need a video camera. To make a telephone call, I needed a phone. To type something, I needed a computer. I needed a calculator, and I needed so many things in 1990 to do this job. But in 2020, all of this can be done by something that I hold in my hand, my mobile phone. Have you ever thought of that? I mean, to those of us who lived in the 90s and 80s, we need about 20 things to do things which now can be done by something that we hold in our hand. Likewise, 20 years ago, we needed different medicines to modulate our immune system, to improve our blood supply, to prevent cellular death, to have an antioxidation effect, to have stimulation of cells. But all of these things now come into one cell, which is called the stem cell. So stem cells are of different types, and this is just a technical, thing of their sources and where they come from. So this is a scientific classification based on what the stem cell can convert into. And broadly speaking, stem cells you can get them from the embryo, which is from the unborn fetus, from abortion or from spare test tube baby embryos. See, life starts when a father's sperm and mother's egg comes together and forms an egg. On the 4th or 5th day of life, we are a grape-like bundle called blastocyst. And this is a bunch of embryonic stem cells, which means all of us, on our 4th or 5th day of life, we were a bundle of embryonic stem cells. And from that, entire body was formed. So these cells have the potential to become any part of the body because the whole body was formed from this bundle of stem cells. But embryonic stem cells have ethical issues about it. Embryonic stem cells medically they can have adverse events. So we do not use embryonic stem cells. I wish to state very clearly, we do not use embryonic stem cells because people confuse stem cells with embryonic stem cells. Embryonic stem cells is just one type of stem cell. There are many other types. So we do not do embryonic stem cell work. You can also get stem cells from the umbilical cord. Now, the umbilical cord is the cord that connects the mother and baby at birth. And it's very rich with stem cells. And if this has been preserved at birth, then you can use these for various, the stem cells from this can be used. And in America, the Duke University is doing some very wonderful work on umbilical cord preserved cells, for autism and cerebral palsy. And they've come out with some nice papers. But we are not using this either. We are using adult stem cells. What are adult stem cells? Adult stem cells are cells within our own body. So in our body, especially in our bone, there is a liquid in the bone called bone marrow, which has got millions of stem cells. So we actually take stem cells from the bone. And the last type is what is called induced pluripotent stem cell. This is a combination of cells where the outside is adult and the inside is embryonic, but this is only in the research stage. This is not being clinically used as of now. So we use adult stem cells only. And the data that you hear after this is all adult stem cell work. So comparing the dangers of embryonic stem cells to the dangers of adult stem cells is like comparing the dangers of alcohol to homemade orange juice. We say both are beverages. So because alcohol is dangerous, homemade orange juice is dangerous. So it's very important, and I'm spending some time on this, that embryonic stem cells are a different subset. They are taken from, unborn fetus and from spare test tube babies. We are not using that. You can't compare that to taking cells from your own body and putting it back in your own body. So comparing them would be like comparing these two. So we work with adult stem cells because they're completely safe. In fact, they've been used for the last 70 years. Adult stem cells have been used in hematological conditions. They've been used to treat cancers, in blood cancers, etc. They never form tumors. They never get rejected because they are our own cells. They're very easy to obtain. Just a needle prick and you get it. No surgery, no procedure. And there are no ethical issues about the use of adult stem cells. Now, how are stem cells injected? So you can inject them, what our preferred method, we take a needle and we inject it into the lower back, into the fluid in the lower back. This fluid is called CSF, because from here, the cells go all the way up to the brain. So this is a very simple way, a simple needle prick into the spinal fluid and it goes up. You could also inject it intravenously, intraarticularly, you could put it in the muscle, you could give it to the nose. There are different ways of doing it, but our preferred method is intrathecal. So we prefer intrathecal because one is minimally invasive, just a needle prick and no cutting, no surgery, no incisions, and the stem cells will go all the way up to the brain and go into every part of the brain where they are needed. So stem cell therapy basically is the use of healthy cells. If I had to summarize, what am I talking about? We're using good cells, healthy cells, to replace damaged cells. That's all we're doing. Good cells to replace bad cells. Healthy cells to replace damaged cells. So here you can see the blue is the damaged part in a child with autism. It's a PET CT scan, you give cells and the damage goes away. So what's the scientific base for stem cell therapy? Now, we're all aware that the highest recognition in medicine is the Nobel Prize. Many of you may have heard of it. And within a 15-year gap between 1990 and 2012, three times, the Nobel Prize went to stem cell research. There is no other field of medicine where so many times the Nobel Prize has been given to one subject. But here, the Nobel Prize was given to stem cells 1990, 2007, 2012. In fact, what we do using stem cells from bone marrow got the Nobel Prize in 1990. So this is science which is actually old. We're using it for new things, but it's an old science. Now, what's the scientific base of the work that we do at NeuroGen? So all our work is published. We have a total of 101 scientific papers. Now, why is this important? It's important. How do you know when you go to a doctor, when you hear somebody, how do you know what they're saying is the truth or not? People could make up stuff. The only way to know when that somebody's results are authentic is if they are published and in peer-reviewed scientific medical journals. What is the concept of peer review? It means somebody outside of you has studied your data, validated scientific content and ethical content. So we don't have one or two, we have over 100 papers, 16 on autism, 15 on cerebral palsy, etc. So all the work and all the data that I'm going to present is all published data. Now we have done many other indications, we have treated many other sort of conditions, but as a rule, I only present that work which is published and peer reviewed in scientific journals. So yes, I'm going to present on about 6 or 7 conditions, but we've done far more, but these are published. Also in textbooks now, they've started introducing chapters. So this is a textbook called Recent Advances in Autism. And they've introduced a chapter on stem cell therapy. And they asked us to write it. So in this book, the chapter on stem cell therapy is written by us. In this European book by Intech on cerebral palsy, challenges for the future, they introduced a chapter, stem cell therapy for CP, and they asked us to write this chapter. In this book on physical disabilities, therapeutic intervention, they introduced a chapter, stem cell therapy in pediatric neurological disabilities. Again, they asked us to write it. In this book on muscular dystrophy, published by Avid Science, they introduced a chapter, stem cell therapy as a therapeutic modality for muscular dystrophy. And this is chapter 2, right in the beginning of the book. Again, this was written by us. So a point I'm trying to make is medical textbooks are now introducing chapters on stem cell therapy for these conditions. And most of them, they ask us to write because we have the world's largest experience. That's the reason why they come to us. Now, in India, the government at the highest level is supportive of stem cells. Our Honorable Prime Minister, Sri Narendra Modi, when he went to Japan, he actually visited the stem cell laboratory of Professor Yamanaka, who won the Nobel Prize. It's not often that prime ministers visit stem cell laboratories overseas. Even within India, whenever possible, he makes it a point to visit stem cell laboratories. to understand things better. This is myself with the Honorable Prime Minister. I'm presenting him a book because he wrote an introduction for a book of mine, and I was presenting him that book. And he's quite well versed with what stem cells are. And this is the introduction. You can see this is my book. It's in our local language. And the Honorable Prime Minister Shri Narendra Modi has written the introduction for a book that I have written on muscular dystrophy. There is a small clip that I'm just showing. This is for the Prime Minister talking in the Indian Parliament. And you can see how passionate he is about stem cells.
मैं जापान गया, तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या है। हम गए तो वहां गए, उनसे चर्चा की, और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So that was the Prime Minister of India talking in the Indian Parliament about stem cells. Now, how often do you hear presidents and prime ministers talking about something in Parliament? And here he was talking about stem cells. All right, so now I gave you a general sense of what stem cells are, the science, the background. Now let us see how is this treatment done actually. So the beauty of this treatment is the simplicity, the sheer simplicity. Normally when we think of a procedure, we think of an operation and there'll be cuts and there'll be stitches and there'll be sutures and there'll be bandages. Well, nothing like that here. This treatment is very simple. So what we do is we take a needle and put it into the bone just above the hip bone. So our hip bone is below, and this is called the pelvic bone. And we put the needle into it. The child is sleeping, is sedated, and we give local anesthesia. And then we aspirate. We take out the bone marrow, and this takes about 15 or 20 minutes. Once we've got the bone marrow, we take it to a laboratory, and then we run it through some machines called centrifuges and some other machines, and we separate the stem cells. Please note, we don't do anything, we just separate. So we have bone marrow, it's got 50 types of cells. We need one type of cell, that's stem cells. So we separate the stem cells, throw away the rest. And once we have the stem cells, then with a very thin needle, we inject it into the fluid in the lower spine, and it goes all the way up to the brain. So in this whole treatment, there are only 2 needle pricks. With one, we aspirate, and with the other one, we inject. And what are we injecting in the child? His or her own cells. There is nothing from the outside. There is nothing artificial. There is nothing chemical. There is nothing. This is natural healing. Taking good cells from one part of the body and putting them where they are needed in another part of the body. So let's see a small video of how we do this procedure. So there you can see this is the bone marrow aspiration. You can see the liquid coming out. And then we take it to the laboratory. We put it in these machines called centrifuges. We check the cells. There are some very sophisticated machines that tell us how they are. And then with a very thin needle, we inject it to the lower spine. And these are the stem cells. So let's just look at this video again. All right, just to, so you understand. All right, so there the child is sleeping and the bone marrow is coming out, and we take it to the lab, and we count the cells, we check the viability. So this takes about 4 hours or so, and then we inject it back. Very thin needle. This needle is thinner than the needle with which we do our blood collection. It's a very, very thin needle, so there's no major residual pain or anything like that. Just again to, the bone marrow aspiration, stem cell separation, and a very thin injection, right? So now let's look at autism. And I'm going to spend some time because I was told this program has been arranged by Autism We Care. And although I'm going to talk of multiple other neurological conditions, we're going to majorly focus on autism because I was told the majority of the audience is going to be parents of children with autism. So we're going to talk a little bit about this. Now, the first thing I'd like to point out is the increase in 2004. Now, these are statistics from America. These are US figures. It was 166 in 2004. 1 out of 166 kids had autism. In 2018, it had become 1 in 59. In 2020, it's actually become even worse. So, never before in the history of mankind has any disorder in children or any neurological disorder increased so much in such a short span of time. When we were medical students, autism almost didn't even exist. It was such a rarity. And now it's becoming so increasingly common. Everybody's heard of somebody who has a child with autism. So, going up from, 166 to 159, which means that 70 million people on the planet have autism. 70 million. That's 1% of the world's population. That's huge. Most of you didn't know that 1% of the world's population has autism. So what exactly is autism? So autism is basically a neurodevelopmental disorder. It described first in 1943. You normally diagnose it in the first 3 years of life, and boys have it 4 times more than girls. Now the problems in autism are 3. There's problem of communication, there's poor social interaction, and there are repetitive behaviors. Now these combinations are increase and decrease differently in different children, but these are broadly speaking what the problems are. What is new is we have a better understanding today of autism, and I'm going to share with you how we understand autism better. And we have this new treatment called stem cell therapy for autism. So that is what is new, and that's what I'm here to highlight to you. So one question that very often, so when I talk, a lot of parents have this thing. Well, why did my child get autism? Like, why me? So for that, I'll just very briefly talk to you about the main 4 causes. Very often it's a problem during the birth process. When the child is in the womb or at the time of birth, intestinal dysfunction has been related to autism. There's exposure to toxic chemicals and use of mobile phones. Let's just briefly look at that. So any health issue with the mother, like an infection or like diabetes, or even emotional issues like depression, can predispose the child to having autism. So the mother's health is so important if we want to prevent autism. And not just the physical health, the emotional health as well. Stresses and strains and anxiety and unhappiness can actually release chemicals that can produce autism in our child. Mothers who have polycystic ovarian disease and mothers who smoke, there's a greater chance that their kids may have autism. Now, older fathers have a greater chance of autism. For example, a father at 45 is 3.5 times more likely to have a child with autism than a father at 24. And today you're noticing that, we are having children later because of work and professional pressures. And this could be one reason why autism is increasing. Kids with autism, 9 out of 10 kids have a problem in the intestines, because in the intestines we have good bacteria and bad bacteria, and any imbalance between them can trigger changes, and there's a direct connection between the gut and the brain. So, and that's a different topic all by itself. So, then also, this is something people don't realize, that exposure, that mobile phones, when we use mobile phones, there is a radiation that flows for a very short distance. And for a mother who's pregnant, if she's on the mobile phone for a long time, this radiation could possibly have a damaging effect on the brain. And we now know how it damages the brain. Our brain has a security system called the blood-brain barrier, which doesn't let negative chemicals enter the brain. Now, radiation from mobile phones damages this, and so now the protection of the brain is gone, and more toxic things from the blood can enter the brain. Different things like lead, for example, has shown to, a lot of children with autism have high lead levels. And there was a study done in India by an Australian university which actually showed high levels of lead in various children having intellectual disability, autism, etc. And the sources of these included, amongst other things, noodles. So one of the most popular brands of noodles that most kids had a very elevated level of lead. Mercury as well as aluminium also have been attributed to causing autism. Now, this is a little controversial because in 1998, Dr. Wakefield presented a paper. He proposed that the preservatives used in vaccines could be causing autism. He was referring to the MMR vaccine. And this created a big furor in the medical world, because of this, people would stop taking vaccines. But later, there were 25 articles that showed that there was no connection between autism and MMR vaccine, and that Wakefield's paper had to be removed because because of the controversy generated. Now, as a medical doctor, I have to tell you one thing: vaccinations save lives. So whether you like it or not, whether you believe it caused autism or not, please do not stop vaccinating our children. Our children need the vaccination to protect them from many of the diseases that we've eliminated from our countries and sometimes the planet. So the jury is yet out. Is there a connection between autism or not? There are very different views on it. There are some people who are for and some people are against. But as a medical doctor, all I can say is, please vaccinate your children irrespective. Now, this is our original research, and I'd like to highlight this. So this is this has never been shown before, but we actually showed that this is a scan of the brain called a PET CT scan. And whatever is blue here is brain that's hypermetabolic. That means it's working less, it's less energetic, it's less strong, it's less functional, partially damaged, whatever. The darker the blue, the greater the damage. So this does not, and we've done this in 2,500 children with autism, and we have seen this in every single child of autism, every single one. In a research project that we did this in normal children who had some other problem. The PET scan was being done for something else in the body, and so not a single normal child had this blue, whereas every child of autism had this. So now, for the first time, we know why our child does not speak. We know why our child has behavioral issues, memory issues, because this blue corresponds with those areas that are responsible for the symptoms. And this work of ours is published in a prestigious journal called the World Journal of Nuclear Medicine, where we have shown the baseline pattern of what happens in the brain with autism. Now, here's something very interesting. So our research showed us something interesting. This is the value of brain function, SUV, and the higher it is, the better it is. This is age. So you can see 0 to 5, 5 to 10, 10 to 15. Now, if you take normal children, blue is normal children, their brains functioning keeps on increasing over age. So you can see the brain functioning keeps on getting better. But in children with autism that you see in orange, the brain functioning keeps on decreasing. All right. Now, we did not know this till we started doing this. We actually saw that there's a sustained decrease in function. Now, why is this important? It's important because, see, we keep hearing of early intervention, whether it's for rehabilitation, whether it's for any other treatments, and whether it's for stem cell therapy. The reason is, if you see, this is a normal child's brain, right? And we want our child to get normal. We want this graph to go upwards. Okay, so if you're here, there's a much lesser distance to travel as compared to if you're here. This gap is much bigger. So obviously, treating here, it's easier to get good results as compared to here, where we have to work harder and it's more difficult to get results. Now, the management of autism over the last 10 years has become multidisciplinary. So there are multiple, and this is the point I want to make. There is no one silver bullet for autism. You have to do everything. You have to do all the rehab. You have to do occupational therapy and applied behavioral analysis and speech therapy and special education. What we are saying is that along with all of that and the integrative treatments like hyperbaric oxygen, chelation, biomed, all of that, aquatic therapy, neurofeedback, all of this has to be combined with stem cell therapy. And together, we are going to get our children out of autism. So stem cell therapy does not work alone. It does not work in isolation. It works when all the rehab is done and when all the other integrative therapies are also done. So let's look a little bit at neuro rehab for autism. There is applied behavioral analysis. You all know that. It's based on the fact that for every behavior, there's an antecedent effect and a consequence, and by modulating that, you can modulate behavior. There is, of course, occupational therapy, which is very holistic, which includes different aspects, focus on activities of daily living, vocational rehab, play therapy, school skills, social skills, etc. Then there's sensory integration therapy, which is again very important because several of these kids have sensory issues. This is what a sensory integration room looks like at our hospital, especially design rooms. Speech therapy is again very important. And here there's been a shift. The earlier thinking was only speech is important. And now the thing is, more than speech, communication is important. Okay, it doesn't matter how good or bad the speech is, the child should be able to communicate. So the shift is from verbal speech to communication. Then physiotherapy. Now earlier it was believed that children with autism don't need any physiotherapy. They have no problem with their body. This is not true. What we have found is that because the cognitive issues are so severe, we don't focus on their bodies, but they have. They've got motor coordination issues, clumsiness, tonal, tone abnormalities, their gait, their postural instability. All these need correction. So we have now started believing that children with autism need physiotherapy as well. Aquatic therapy is another amazing thing, and we've seen some excellent results with, it helps with their cognitive function, attention, concentration. Most important, it improves their sleep patterns. So aquatic therapy itself, aquatic therapy is not swimming, it's rehabilitation in water. And you have specially trained rehab people who do that. And we have a separate department of aquatic therapy in our institute. Then there are various art-based therapies such as music therapy, drama therapy, etc. There are also certain other treatments like chelation and TRS detox, etc., which some people use. There are a lot of people use supplements like vitamin B6, vitamin C, omega-3, DMG, inulin, etc. And all these have roles. Diet has an extremely important role to play. So there are foods to eat such as probiotics, prebiotics, ketogenic, gluten-free and casein-free diets, and there are foods to avoid like sugars, additives, pesticides, etc. So you need to have a good nutritionist, dietitian involved who can guide you with what to eat and what not to eat. A ketogenic diet is one which is high in fat, just has enough protein and has low carbs, and this is extremely useful in autism. But despite this, are we doing enough? I mean, we do all of this, we do all the rehab, and we do our, you go to a biomed doctor, and you do chelation, you do all that, and still our children have behavioral issues. They still can't talk. They can't go to normal school. So that is where we have the role of stem cell therapy. And we've treated, of course, over 2,500 patients now of autism, but this is data from 700 because you have to have a long follow-up, after we do the treatment. So you can see 33.6% of the patients show a significant improvement. That means they are no more on the autism spectrum. I'm going to repeat that. They are no more on the autism spectrum. When they go to their doctors say their diagnosis is not there. These are kids who are going to normal school, like you saw in the movie Ganesh, who's going to a normal school. There are kids who are going to college, who are earning, right? So that's 33% of our patients. 29% have a moderate improvement. That means they improve to the point that they become independent, but they still need, a little special care. They aren't able to go through the education as well, as the other 33%. 25% have a mild improvement and 10% don't improve. Now, we were, of course, when we analyzed our results, and this is data from several years ago, we were intrigued by this. Why? How come? And then we noticed something very interesting. We found that all these kids were below 11 years. In fact, not 11 years, they were all before puberty. So treating our children before puberty is very important because the moment you cross puberty, they came into this area, after 11. And this 10% who did not improve were all over 20 years. Now, this matches with that graph. Remember that graph I showed you that the problem in kids with autism keeps on decreasing and normal children is like this? So obviously, the later you treat, the lesser results you get. So that's the importance, that's the urgency, because a lot of people say, let's wait, let's get stem cell therapy be more established and so on and so forth. But we don't have time because the longer we wait, the lesser are the chances of a full recovery. And so we need to do this treatment as soon as possible to get the best possible result, because that's what we want. We want our kids to go back to a normal life. We want them to go back to a normal school and college, study and earn and do all the stuff that we did. So, so this is just to show you that there's an age relationship to these results. And these are just some of the symptoms that improve, different symptoms. I think you can't see them, the thing below, but there was speech, hyperactivity, attention, eye contact, etc. Now, I'm a responsible doctor, okay? I'm professor at the University Medical School, and I'm saying that autism can be reversed. Okay, now that is an outrageous statement to make. What is the base of that statement? One is, of course, my publication. So I have 16 publications, but I have statistical significant data, and also I've got objective evidence, not what the parents say, not what I say, but scans that actually show the improvement. So this is just to show you what is the meaning of statistics. So like this is a scale called the CGI scale, and this is an Indian scale for autism. We take SCT stem cell therapy. So we take the score of all the patients, all before the treatment, and average it. It is 4.5. And then the same thing, we take the score after stem cells, and it is reduced to 3. By a mathematical calculation, we can see that it is statistically significant. Same for ISA score. So only when, by this mathematical calculation, you can show a statistically different result, significant result, can we say that the treatment works. Here again, to show you the different components of the scale, and you can see all of these were statistically significant. But this is the most important slide in my talk, because this shows you. Now I have, by the way, I have 2,500 such scans, 2,500. And I'm just showing you 2 or 3 because I can't show you 2,000. Obviously, on top is a child of autism when he came to us. Look at this. Can you see the damage? The blue here, the blue here. Look at this. Look at it very carefully. This is the same. This is looking at from the side, from the front, and from the top. The same damage. Now the same child, look below, 6 months after stem cells, and you can see that the blue is gone. You can see that the hypometabolism has disappeared. You can see that the damage is significantly reduced. This is objective proof, my friends. This is objective proof that stem cells can reverse the brain damage, okay, in autism. So here again, you can see before, you can see that blue stuff, and you can see later, it's gone. This is again blue, and you can see that after the stem cells, it's gone. Then some people asked us, well, because we do the scans at 3-6 months intervals, and they would ask us, well, how do you know it doesn't come back? I mean, maybe after 2 years, 3 years, this blue comes back again. So in a few patients where the parents were concerned, we did it year after year. You can see this is 2012, 13, 14. You can see the damage before, it is reduced, and 14, it is still reduced. So the improvement seen after stem cells is a progressive one. It's a sustained one. It's not like it improves now and then we go back to where we were. No. The improvement continues over the years. So our work is published, and the world's first international publication on stem cell therapy in autism came from India, and it came from us. This is our paper, Stem Cell International, and it's a real honor to be the first person in the world to publish our results of stem cell therapy in autism. Now, the second paper after us came from China. The third paper came from Italy, and the fourth and the fifth paper have come from the Duke University in America. So we are ahead of Europe and America. India and China are ahead of them in the field of stem cells, for sure. And apart from that, we have a total of 16 papers. That was the first paper, but we have 15 other papers after that. Now, a lot of parents ask us, can we combine stem cells with other treatments? And the answer is yes, you can continue whatever you are doing. So there is no contraindication to combining stem cells with any treatment. So whether you're doing biomed, HBOT, chelation, TRS, whatever you're doing before can continue. We will ask you to stop nothing. Now we had actually 5 movie clips from 5 children with autism from different continents, but we won't see all of them. The one from the US you already saw, that was Ganesh. We'll just see one of them more. We'll see this one from Africa. So as parents, I know how difficult it is to manage one special need child. It is so difficult and challenging. And you think managing one child is difficult. What? Can you imagine if there was a mother who had triplets, 3 kids, and all of them had severe autism? What would her life be? Let's look at this little story.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye. no child is crying, no child is waving back by. And by then, for sure, I knew that they should be doing that. Children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said his children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far. Please, with water.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he is taken to his bed, it takes a few minutes, and he is asleep.
See my son's cycle. He tried to make them understand what it is to pedal, and he couldn't. But after stem cell, when we arrived in Kenya the following day, and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So that was a family from Nairobi, Kenya, and you saw, and this is a little old movie, but you know, out of these, the kids are doing amazingly well. One of them is now back to almost complete normal, 0 autism. The others are close to getting there, and stem cells make a big difference to this family. Let's just see this. This is among the one of the very early kids we did, and let's see.
Shantanu was my first child, so I was very excited about how he would be. But when I came to know that my child has a problem, it shocked me and I wondered, why did this happen only to me?
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on their feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier he was not able to fold even a handkerchief, but now he can easily fold blankets. He helps me in cutting vegetable and in cooking too. Goes to the market store for purchases. He passed his 10th grade.
Very important. Passed his 10th grade.
There have been improvements in many other aspects as well. For example, this emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions of other special kids.
So you saw that a child who could not speak, who was severely hyperactive, has improved so much. He passed his 10th grade in school, is studying in college, and he now takes tuitions. He takes tuitions for deaf children. So that's like an amazing improvement. Now, very briefly, I know it's taking long. I'll just run through a couple of other things. So cerebral palsy, here the damage occurs to the brain at the time of birth because of less of oxygen. There are different types of cerebral palsy where either one side or both the legs or the whole body can be affected. In cerebral palsy, you see more problems in the body. In autism, more it's in the mind. It's in behavior and speech. In cerebral palsy, the hands and legs are tied. The children can't walk or use their legs. They are wheelchair bound. And here on the scan, you can see the damages. You remember the autism, it was a lighter blue, whereas this is a darker blue and it's larger area. So the damage is more severe. There are certain medical treatments that we can use to give them symptomatic relief. There are some simple surgical procedures, but these don't take care of the problem. So, but with stem cell therapy, we can repair the damage. This is our data from 660 children. 20% had a significant improvement, means they're back to normal life. 41% had moderate, 30% had mild, 9% did not improve. That's a 91% success rate. Now here, there is no age correlation. So here it's severity. Those with the lighter damage were in the significant group. Those with the severe damage were in the no improvement group. So still 90% of the kids had an improvement. And these are the symptoms. The oromotor, drooling of saliva, that improves balance, trunk, upper limb, lower limb, muscle tone, activities of daily living. So this is the percentage-wise improvement. And here's a scan before. You can see before the blue, and after the stem cell, you can see it's gone. It's much less. Here you can see before the blue, which is the damage, and afterwards you can see it is almost completely gone. All right. So you can see the change. So this is the magic of, and this is objective proof. I mean, there's damage before you give stem cells, and the damage is gone. So that's a clear proof that the stem cells are working. Again, our work is published in a prestigious paper, clinical study on autologous stem cells. So again, all the data I'm giving you is all from published papers. Of course, this was not the world's first paper. It was amongst the world's first few. And we have a whole lot of other articles even after that on cerebral palsy. Now let's see a video of a child from Kenya, completely wheelchair bound. He was quadriplegic, spastic CP, could not use his hands, could not stand, and see the magic after stem cells. You can see now he's able to sit. He could not sit first. He's able to wear his clothes. He's able to pack his bag. He's improved motor activities. He's able to open a fridge. See, this child could not stand. He could not get off the wheelchair. Now he can stand up, open a fridge, take out a bottle of water, open it and drink it. He can actually charge it. And now you can look at that. Look at the difference between a totally wheelchair bound child and a child who's able to walk independently. Yes, my dear friends, we can help our children get rid of their wheelchairs. We have so many hundreds of patients who came to us on wheelchairs and are walking now. Stem cell therapy can help in this. There is absolutely no reason why these children should continue to be on a wheelchair when with stem cells we can get them back on their feet, we can give them use of their hands. So I think children with cerebral palsy should definitely get stem cell therapy. Then there's a disease called muscular dystrophy. I'll go through this very fast. In muscular dystrophy, the muscles degenerate. And you can see here at 5 years, this gray is normal muscle. And you can see over the years, the muscle disappears, it becomes white. And at 16 years, it becomes total fat. You can see here at 5 years, nice gray muscle. At 21 years, there is almost nothing. So in this particular type called Duchenne muscular dystrophy, around between 21 and 25, all these children die. There's 100% death, 100%. Every child dies. And we have been able to treat them with stem cells and we have been able to save their lives. And now they're going way beyond that. So these are our results. So no 1,500. The significant is much less, only 4.5. Moderate, mild 20%, 14% stable. Okay. Now you have to remember that if untreated, all these children would have continued to deteriorate and die. So if we are giving this kind of, even if you're making them stable, that is good. Okay. So that's 85. Now this is a study we did where it's called a controlled study where patients who were treated with stem cells were compared to patients who were not treated. And you can see the not treated patients deteriorated like this, and the treated patients, they stabilize like this. So there's a big difference between treated with stem cells and untreated patients. And here is MRI proof. So here's an MRI before, which shows all white, that is fatty area. And after stem cells, it has become this black dark thing, which is like muscles. So you can see that muscles are forming where the stem cells have been injected. And this is an EMG. You can see the wave, it's a weak wave. And after the treatment, the wave improves significantly. And we have 18 scientific papers. So all the results are published in scientific journals. Here's a child from the United States, from California. When he came to us, could not sit, could barely crawl. He could not stand. He had not stood up for 2 years. And let's see these improvements after stem cells. He was totally wheelchair bound, could barely crawl when he came to us. You can see before, he's hardly able to crawl. And now you can see, after stem cells, first he learned to stand. He stood for the first time. For the first time in 2 years, he stood on his feet. And apart from standing, he started walking a little, but this at first using a walker for support. And then without a walker, just using parallel bars, started moving. Now there was no movement there at all. So whatever little you see is like a major accomplishment. Now he's walking without any help, but indoors. And now you can see he's walking outdoors without any help. And he got invited to meet the President of the United States, President Obama, and he was invited to the White House, where he shared his results and his improvements. Then there is intellectual disability, where you can see the damages of a slightly different type. It's lighter, but it's more diffuse. These are our results: 20% significant improvement, 25 moderate, 39 mild, 13% don't improve, and their memory, problem solving, social inhibition, toilet training, all of this improves. And here you can see a scan before, you can see, and afterwards. You can see that the damage is gone. You can see the damage before and afterwards. So in intellectual disability as well, we can reverse the damage. And this is the world's first paper on, this is an open label proof of concept study published by us using intrathecal bone marrow mononuclear cells. And here again, we compared to patients who had not been treated, and we showed good results. And these are some of the other papers. Spinal cord injury, I'll just rush through things a little fast. So if people who have fracture of the spinal cord, they get paralyzed, they cannot use both their lower legs. And here you can see 24% of the patients had a significant improvement. They started walking again. 56 had moderate, 15 had mild, 3% did not improve. And these are all the symptoms. There's spasticity, sensory, bladder, bowel, trunk, etc. And again, this work is published in an international journal. This is data for thoracolumbar spine. We have several other papers after that paper as well. This is a story of an Indian soldier who was shot by terrorists. He was totally paraplegic when he came to us. He could not move his legs. He could not even sit up. And we treated him, and let's see his improvements. So when you could see before he could barely sit, and afterwards he's able to sit by himself. He's able to use. He's able to. Earlier he had to be supported for everything, and now you can see he's able to move on his own. And when he came to me, he told me, "Doc, make me good enough so I want to go back into the army. I want to go and kill more terrorists." And I promised him I would do that. And here you see he's walking now. So from being unable to sit or stand, he's walking. He was awarded the highest bravery award that is given at the hands of the President, Shaurya Chakra. He also went back to shooting, and he won his pre-national shooting championship bronze medal. And the army normally does not take back people who are paralyzed and injured, but they actually join back active duty. He improved so much that he joined back duty in the army. Brain stroke, just last couple of things. So brain stroke is when you have either hemorrhage or ischemia in the brain, and there's a paralysis on one side. And here you can see our data, 51% had a significant improvement, only 3.7% did not improve. Here's a scan before that shows the damage, and afterwards you can see after stem cells, the damage is almost completely gone. So in stroke itself, there are excellent results, and all our work is published in stroke in stem cell therapy. And then in head injury, where you have road traffic accidents, and people go into a vegetative coma, and for years they remain in a coma. And here you can see our results: 29% have a significant improvement, 5% don't improve. And here's a scan. You can see the blue damage before, and you can see after stem cells, that damage is gone. And again, this is published in our entire series of pilot study, published in Springer Plus, one of the very well-known journals. These are other papers. And then motor neuron disease. So this is a disease in America. It's called ALS. And here, 90% of the people die within 5 years, in 2 to 5 years. And then we did a comparative study. There's a control, that is patients who did not receive stem cells, and this is how they deteriorate. And the ones who receive stem cells, they stabilize like this. So we showed a definite improvement over untreated patients. And our work is published in the American Journal of Stem Cells. This is a control study where we showed that patients treated did much better than patients untreated. And these are our other papers. And I'd like to, one of my colleagues, this is a video of Dr. Himangi Sane. She's one of our colleagues. She was a doctor in America. She did her MD from New York University, and she developed motor neuron disease. She went to the best hospitals in America. Everybody told her, you've got a few months more to survive. But she didn't give up. She came to India. I gave her stem cell therapy. It's 10 years since then. And not only has she improved, but she works as the head of our research. Let's hear what she has to say.
I am Dr. Himangi Sane, a graduate from Seth G.S. Medical College and KEM Hospital, and MD from Neurological Medical College. I was practicing as a consultant in New York when I developed motor neuron disorder. I started deteriorating neurologically, and so I consulted the best doctors in America, including John Hopkins, who told me there was no hope and this was a fatal disease. Then I came to India and approached Dr. Alok Sharma, who treated me with stem cells 10 years ago. After stem cell therapy, there has been halting of disease progression and improvement in speed, swallowing, and stamina. I have improved significantly and now working as head of research at NeuroGen Brain and Spinal Institute. It is my request to all my medical friends and colleagues to please consider stem cell as a treatment option for incurable neurological disorders. I am a living example of the potential and power of stem cell therapy.
So there you are, an MD doctor, qualified, working in America. In America, she was told she's not going to live for a few months. She came to India and she's well. And, some time ago, she tried to contact, when you have a disease, other people who have the illness. And she tried to contact all the other people she knew. And you know what? All the people who were diagnosed with her, who stayed back in America, are now dead. She came to India and she's alive 10 years afterwards. All right. So that's the potential of stem cells. So one question in everybody's mind, are there any complications? I'm sure that's the big question. Are there any complications? How can anything be so great? Is it safe? So two things. One, complications can be divided into major and minor. Major is something serious, something irreversible, something that does damage, something that does harm. So we've treated over 10,000 patients and we've had no major adverse events or complications, right? No patient has deteriorated neurologically so far. Okay, so there is no, because of the stem cells, there is no complication that is stem cell related that's major. But we do have some minor adverse events, like, for example, we have found that in children who already have epilepsy, 3% of those can have repeat epilepsy within the next 2 months of stem cells. So these are children who have continuous epilepsy. The epilepsy can get aggravated just after stem cells, but not in all, because people hear this and say, oh, my child will get epilepsy. Only if your child already has epilepsy. And it's not in every child. 3% of those, out of 100 kids, 3 may have epilepsy in the first 2-3 months, but we found a way around it. We give medicine, it gets controlled. 10% of the children have a headache immediately after the stem cell, which lasts for about 2 days. This is a peculiar headache because it goes away on lying down, it comes up on sitting, but it goes away in 2 days. So it happens when you're in the hospital. So it never happens when you go back. Some kids may have a little vomiting, nausea, etc., but nothing severe. So there is no major adverse event. It's a completely safe treatment. And I never used to say this earlier, but after 10,000 patients, I can say I can give a personal guarantee or assurance that nothing will go wrong with your child, right? So this is our institute, the NeuroGen Brain and Spine Institute, and now we have 2 hospitals. We have, we are working in 2 different buildings. This is the main one. And we have treated over 10,000 patients from 70 different countries from across 6 planets. So, we have the world's largest experience. There is no other center anywhere on this planet which has treated more than 10,000 patients. This is our core team. Apart from myself, Dr. Nandini and Dr. Prerna are the stem cell experts. Dr. Jacob, we're very fortunate to have him with us. He's India's senior most physiotherapist and dedicated neurorehabilitation therapist. And Dr. Himangi, you heard of. He came to us as a patient and then she improved so much that now she works with us as head of our research. We believe a lot in quality control. So our laboratory is good laboratory practice and good manufacturing practice certified. We have an ISO certification as well. This is our stem cell lab. It's got the best equipment on the planet because this is the heart of what we do. We have an accreditation by the European Medical Association, that's EMA, for best medical practices. So this is an important certification because it comes from the European Medical Association. We have published 18 books. Some of them are for doctors, some of them for therapists, and many of them are for parents. We have received numerous honors, such as the Rose of Paracelsus Award, which is from the Socrates Nomination Committee of Oxford. This is a very prestigious award which you get for pioneering research. The European Society for Quality Research also honored us. This was at their Brussels meeting, and we got awarded as for our best practices. I received this award in the British Parliament. It's called the Bharat Gaurav Award, and it is given in the British Parliament. This was last year. We were nominated as the best stem cell therapy center in India in 2016 at the National Healthcare Excellence Awards. We got the same award again in 2018, and this was given to us by the Minister of Health from the Union Ministry, the best stem cell therapy center in our state of Maharashtra. So now to help you make the decision, you could visit our website, which is neurogenbsi.com, and all the information you want, you'll get it there. You could email us at contact@neurogenbsi.com, and you have a response time within less than 30 minutes. So if you write an email to us, within 30 minutes, you will get a reply, and the reply comes from a doctor. It's not an administrative person. We have a doctor around the clock who will reply to you. You could WhatsApp chat, audio, video call. You could call us on a number, or you could set up a Skype or a WhatsApp video interview. So I just want to tell you that all those of you are registered here, you're entitled to a personal one-on-one discussion with me with a prior appointment. So this is and that's free of cost. There's no cost to it. So you will have to, coordinate with our main coordinator, and we will help you set up a one-on-one discussion with me where you can discuss whatever you want personally about your child or about the patient. Now, once you've decided you want to take stem cells, we appoint a specific coordinator. There is a one point of contact, and this person will assist you through the entire process till you come here. This is what we do. We have a 1 week plan. So you arrive on a Sunday. It's arrival on Sunday only. It's a once a week thing. On Monday, we do all the evaluations. On Tuesday is the actual stem cell. That stuff, the video I showed you where we aspirate bone marrow and put it back, it happens on Tuesday. Wednesday to Saturday is rehabilitation and integrative treatments, and Saturday we discharge the patient. So it's a 1 week program. Now, is it safe and easy to travel to India? So we had a patient who came recently from Zambia. We just video recorded what she had to say. And
my full name is Lorraine.
She came from
I'm
Zambia.
from the Banda. I use Banda because I'm married. I am from Kitwe, Zambia. Zambia is a country in Africa, Central Africa. That's where I am coming from. I came on the 27th of November from Lusaka, Zambia, via Dar es Salaam in Tanzania to Mumbai, which is in India. I brought my son to the NeuroGen Institute, Brain and Spine Institute in Maharashtra. From Zambia to India, I traveled safely. All that is required, should I say, for a person around this time of the COVID period to travel is to have the COVID certificates, which I did. We managed to get them on time to travel. So traveling from Zambia to Dar es Salaam was all right. They did not ask a lot of issues other than the exemption certificate from the NeuroGen Center. That's the very most important document. That one has got to have in order to travel. Otherwise, they don't allow anyone on the plane. So once they saw that one from Lusaka, Zambia, they asked the same. Even in Mumbai, when I arrived, it was the same document. The NeuroGen team have been very, very excellent in as far as giving documentation is concerned. They are efficient. They produce the information right on time. They never delayed. In my preparations, I had them on time. The NeuroGen Institute, the NeuroGen Center, is very, very accommodating staff in my country. They're just giving visas for medical travel. It doesn't matter where you're going, but it has to be a medical visa. That medical visa is issued to the person who is traveling, who is sick, as well as the attendant for attendance. So the airports are not congested as before. The airports are just okay, but still there are a lot of people traveling.
So that just to tell you that travel is not that difficult even in the pandemic time. So why NeuroGen? We are just going to summarize because we have the largest number of scientific publications. Whenever international book editors want to put a chapter on stem cells, they ask us because of our experience. We are the only stem cell therapy center in the world that does only neuro cases. So we don't do other things. We have an expertise in this. We use the safe autologous cells. We inject them intrathecally directly into the brain. We combine it with rehab, integrative therapy. We have treated over 10,000 patients from 70 countries over the last 10 years. We have a senior experienced professional team, and we're constantly researching into what new can be done. And our work is approved and monitored by a government certified institutional ethics committee. So my conclusion is that adult stem cells, what we use, are safe and very effective in the treatment of autism, cerebral palsy, and many other pediatric and adult conditions for which there are no definitive treatments. I'd like to end by quoting Mahatma Gandhi, who said, "To believe what has not occurred in history will not occur at all, is to argue disbelief in the dignity of man." So just because we could not treat autism or cerebral palsy or paralysis or motor neuron disease before, doesn't mean we cannot treat it now. Of course we can. So to repeat, this is what we are doing now. We are doing rehabilitation on broken, damaged tissue, and what we need to be doing is doing rehabilitation on repaired tissue. So now we've added to our program what is called integrative therapies. So we have this this is the hyperbaric oxygen chamber in our hospital, and this floods the body with oxygen at higher pressure, and then this is it goes to every nook and corner of the body, the brain. It helps in improving in autism and cerebral palsy. So the combination of stem cells, these treatments like hyperbaric oxygen and rehab, they work. So this is just to explain to you the role of hyperbaric in autism and CP. These are just some of the scientific papers. And then we have something called ozone therapy. So oxygen is O2, ozone is O3. And there are different ways in which we can give ozone. And this also has shown to have a very beneficial effect in various neurological conditions. Since there are a lot of gut problems, we have a gut cleansing procedure from coronal hydrotherapy. We have some other equipment like cryotherapy, etc., infrared, intravenous high dose vitamins. So all these therapies together, so these are combined with the stem cells and the rehab. And together, all this makes a difference. So the future of cellular therapy is in something called anti-aging. And anti-aging is to prevent the preventable and to delay the inevitable. So it's possible to slow down the aging process, and we are now treating all these other conditions. These are not treated with stem cells. These are treated with integrative therapies, diabetes, obesity, osteoarthritis, etc. And these are all the treatment methods available. So we have actually, between our two hospitals, all varied kinds of treatment. So I'd like to end with this slide, an idea whose stem cell therapy is an idea whose time has come. And we'll hear a speech of President Barack Obama on stem cells, and then we will end with that. So,
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So I thank you for your attention, and I'm open to any questions. Sorry I took a little longer than I should, but I'm open to any questions. So please, you can ask your questions.
Scientists.
So Dr. Deepak Singh has said autism, ADHD, IDD, rehabilitation and its therapies. So yes, we are treating autism, we are treating ADHD, we are treating intellectual disability. So what we are doing is we are offering apart from rehabilitation, we are offering stem cell therapy and integrative therapies. And unlike if you do only rehab, it is like when you do only rehab, you are doing rehab on a damaged brain. Once you do cell therapy, the brain recovers. So the same results of rehab. It's like if you're doing rehab on a damaged brain, if you get X results, you repair it with stem cells and do the same rehab, you get 3X or 4X results. So you get better results. There's an anonymous attendee who said, my child is recently diagnosed with DMD. Can you help, please? Yes, we can. We've treated over 2,000 patients of DMD. What we have found is that with our treatment, the deterioration stops. If you don't treat them, all these children have a life till about 25. Our patients have crossed that, have gone into the 30s. So they get back strength in their hands and legs. They are able to, get off the wheelchair. Like you saw in that video, the child who could barely crawl is now standing and walking. So those are the improvements possible. We can treat with DMD, and DMD I think we should treat because this is, unlike autism and CP where there is there are limitations to what they can do. In DMD, the life is in danger. So if you don't treat, the life is in danger. So I strongly recommend in DMD, we should not waste time. Please, let's take the treatment as soon as possible because with that, we will help to save life. Anonymous says, my son is on steroids for 1 month. So after how much time can we plan for? You can continue with the steroids. So we are not going to stop the steroids. When you come here, you can continue with the steroids. Gradually, as improvements come from stem cell therapy, you can stop with the steroids. There's no audio, right? People are not getting audio. Then cerebral palsy seizure management. I gave 300 phenytoin extended with the patient. The result is delay. So like I said, again, we see all the medical management, so Dr. Deepak Singh, you are asking about seizure management for cerebral palsy. And seizure management is very individual for each child. It depends on the child's weight because we don't know what the weight is here. And the dose has to be adjusted. In case phenytoin is not working, we may have to add other drugs. So we have an option of a whole lot of anticonvulsant drugs, but sometimes when you can't increase the dose too much, it's better to add another drug. And once we do stem cell therapy, hopefully there'll be an improvement in that, and we may be able to progressively reduce the dosage. There is no audio. My son EEG is epileptic from is any effect after SCT? Yeah, so see, we have to understand. So Rajnikant Pal is saying my son's EEG is epileptic. So we have to understand what the problem is. So you can communicate with us. You're entitled to a free one-on-one personal discussion with me. So please take the time, and I'd like to know more about your child. What are the symptoms? Have you done an MRI scan? What treatment he's getting? And then we'll see what epilepsy he has. And we like to see the EEG, and based on that, we will decide what to do. But I can't really help you because I don't have information on that, Mr. Rajnikant. Anonymous attendee is saying, if autism is caused by gastro issues or some other relative issues, how can we be sure that as you fix that, it will not come back as the underlying cause is still present? So that's a very interesting question. Somebody said, if autism is caused by gastrointestinal issues or some other relative issue, how can you be sure that even after SCT fixes this, it will not come back as the underlying cause is still present? So here's what we found. We found that a lot of kids we had kids used to come with us who used to eat mud, who used to eat chalk, who used to eat salt, chili, eat their own poo. And when we repaired the brain damage, this completely stopped. So the earlier belief was that, so although, I showed in my causes GI being one of the things, because that's the traditional thinking, what we are finding is that when you repair the brain damage, the intestinal bowel movements improve and the GI issue also clears up. So all the children who were eating all these other things because of GI thing, the moment we did stem cell therapy, they stopped doing that. So we are finding that the GI problem goes away once the brain damage has been resolved. Then the next question of this anonymous attendee is, anticonvulsant medications might be continued for 3 to 6 months after SCT. What are the side effects of that? So anticonvulsant medicines are only given to those children who have epilepsy before or whose EEG is abnormal. We do not give anti-epileptic drugs to all SCD patients. We do not. We do not give stem cells to all patients. We only give it to those who have epilepsy. And giving it for 3 to 6 months in a relatively low dose has got no side effects. My 4-year-old son had febrile seizure for 5 times so far. We went to a neurologist, but since the seizures were only during fever, he suggested not to do EEG again. Do you think this will increase the chance of seizure effect if I go for stem cell therapy? So we can't, it's difficult to answer that question. What we'll have to do is we'll have to do an EEG right now. When you come to us, we do an EEG for everybody. And what we find is that if the EEG is normal, then there is no risk of having seizures again as a side effect. If the EEG is abnormal, there is a 3% possibility, 3%. That means out of 100 kids, it may be that you are one of the 3 kids where it can increase. And if it does, we can treat with medicines. So I would say that there is nothing to worry. We will do the EEG. Even if it is abnormal, I don't think there will be, the chances of having seizures are very, very low. We mention it because it is our duty to mention it, but the real chances are extremely low, very, very rare that children have seizures. Then again, anonymous attendee asked, what if you want to stay longer in NeuroGen for comprehensive post-SCT to get better results? Do you have an accommodation package or anything related? So yes, we have now 2 hospitals, and in our second hospital where we have it is possible to stay for longer, and our administrative team will discuss with you. There are some people who want to stay for much longer. Then we help you rent a house or a flat where you can stay in the flat and come for rehab. But yes, once you come here, we will look after you. Whatever you need, whether it's to stay in the hospital or to stay outside, we'll take care of it. And we do have special packages for that. Then another question of anonymous attendee. I've heard that in the past few cases, ADHD with autism patients showed increased amounts of hyperactivity after stem cells. But I do not know if and how those symptoms got handled. Can you please let us know for increasing our confidence? Okay. So this increase in hyperactivity happened to almost every special need child during the pandemic, whether they had taken stem cells or not. Now, some kids after stem cell had happened because they had taken it, but during the last 9 months, almost every parent has said that they've had issues and that their hyperactivity is increased. Now, immediately after taking stem cells, for about for the first 3 weeks, there can be a little increase, because that is when the stem cells and the brain are coming together. There can sometimes be a slight increase, but this does settle down. You have to remove the pandemic out of this, because during that time, all kids had hyperactivity, all kids had behavioral issues, because the whole situation and circumstances were very, very difficult, because it was difficult for them to adjust to everything, all the things that were happening. There were people staying at home, they couldn't go out, they weren't getting rehab. So if it is there, we will handle it. Yes, for the first 3 weeks, it is possible that there can be some increase, but then eventually it settles down. The incidence of increase is sometimes triggered by various events. So if there is hyperactivity, we have to understand why it is happening, what is upsetting the child, because you have to understand what happens with SCT. Their awareness increases, they are more aware. Okay, they make more distinctions, but we still continue to treat them the way they were before, without understanding that their awareness is more. And that is why they start now, there are things that they don't like, there are things that they like, and so they start behaving differently. But all of this is manageable. So anonymous attendee says, is the main reason for stem cells to not work is just the age only, or does the gut issues play a role? Can we do stem cells even? Yes. So gut plays an important role, but what we are now seeing is that once we repair the brain damage, the bowel movements get better, and the gut issues do resolve. And now we are adding a gut cleansing gut cannulling has been included recently as part of our treatment protocol. So, you don't worry about that. We'll take care of everything. We have to repair what we see, and then we have to slowly start working on all the other issues as well. So, yes, age is definitely an issue. So, those children who come to us after 20 years, their age is a definite issue. Gut is not an issue. I repeat that. Gut is not an issue for results or no results. The main problem is age. So if you come earlier, you will get better results. If you come later, the results may not be as good. And I'm repeating again, our experience has been after taking stem cells, as the brain activity improves, since the brain controls the gut movements get better. When the gut movements get better, the gut issues also start resolving. Then another anonymous attendee says, how many shots of stem cells need to be taken? What are the deciding factors for suggesting an autism kid for taking multiple stem cell shots? So this all depends on the amount of damage in the PET scan. So we classify the damage as mild, moderate, or severe. Mild damage children need a single shot. Moderate damage children need 2 shots, and severe damage children need 3 shots. I'm talking in a broad, general way, right? But this will vary depending on every patient. Will the stem cell cause any conflicting result? My child is already on a biomedical homeopathy Ayurvedic treatment. Should I stop this before coming? If so, how many days? No, please do not stop any treatment before you come. You can continue with all your treatments. And when you come to us, we will then tell you what to continue and what not to continue. That's the beauty of our treatment. It doesn't come in the way of any treatment you've been taking so far. That's what I've said repeatedly. As mentioned earlier, my son had febrile seizure, so doctors gave Frisium whenever temperature crosses 99. However, every single time we give Frisium, we have shown increased ability and abundance. We thought this because of fever. However, since the same behavioral pattern emerged every single time we have given Frisium, we think there's a side effect of anti-seizure medicine. In case you decide that my son has to be on anti-seizure medicine for 3 to 6 months after, how can this be handled? Will it stop us from? No. Okay. You know what? Because see, these are sort of very difficult technical questions which I can't answer right now without having seen the child and the medical records. But we've had children like this. Okay, we've had children who had side effects to anticonvulsants. But we have a choice of a whole lot of anticonvulsants, so we don't have to give Frisium. Okay, we have so many other drugs that we can give. So if there's a problem with Frisium, we'll switch to something else. We don't worry about this. This is something we take care of. A lot of our patients have these issues and we take care of it. Then Anonymous says, we did donor-based stem cells recently. How long do we need to wait to get cells from your clinic? No, there is no. So if you've already taken cells from somewhere else, we suggest a 3-month gap between earlier cells and the ones that we give. So if you've taken stem cells before, please wait for 3 months. Then Pallavi Vijay says side effects. So like I said, out of 10,000 patients, no patient has deteriorated, become worse, had some major side effects. There are some minor side effects like 10% of our patients have a headache, vomiting, local. That's for 1 or 2 days after the treatment that resolves. The only major adverse event is 3% of the kids who already have epilepsy can have an increase in epilepsy. But otherwise, it's a very, very safe treatment. No patient has deteriorated. No patient has become worse. Then is SCT only, Pallavi asks, is SCT only for autistic children? My son is lacking social behavior. He's 9.5 years. Will SCT work for him? You know what, Pallavi, this is, so why don't you do the one-on-one personal discussion with me so I can understand better? Because we need to understand what is the cause of lacking social behavior. So stem cell therapy works not just for autism, it works for ADHD, it works for advanced learning disabilities, dyslexia, it works for intellectual disability. So basically it works wherever the brain is not working completely, where on the PET scan you see that blue area. So that's a brain that is weaker, it's a brain that's not working fully. So anywhere, if there is a problem, now if the PET scan is normal, then then the stem cell therapy won't work. So, Anonymous says, when will Dr. Sharma come to Delhi NeuroGen for consultation? I think I should be coming there in March or April once travel restrictions, everything open up. So I should be in Delhi in March. Aarti Gokhale, what would be the reason that stem cells work for some but not for everyone? What makes my child a good candidate for this procedure? So Aarti, yeah, that's a good question. So like I said, stem cells work for children when we do it earlier. Like we said, for all children, when we do it below 11 years, it works beautifully. When we do it after 20 years, it doesn't work so well. In between, it works partially. So the earlier we treat, the better it is. Also, it depends on how much rehabilitation you do. So suppose you have a kid who's done stem cell and you don't do rehab later, well, it's not going to work, because if the brain is like a computer, brain has got hardware and it's got software. So stem cells fixes the hardware only. The software has to be put by rehabilitation. It's got to be put by parents. Therefore, it is very important that appropriate rehab happens. So sometimes parents think, oh, we do stem cells now, my child is going to be okay. No, you have to do rehab. Remember again, we are only fixing the hardware. You have to put the software. Then anonymous attendee says, how will you decide integrative therapy is applicable for a patient? Is it case by case? So integrative therapies are on case by case. When you come to us on a Monday, we will evaluate the child, and everything done at NeuroGen is case by case. We have a whole lot of treatments and everything is individualized. Even the rehab program is individualized. Who will need what? HBOT has a side effect of ear problem and others because of pressurize. How this handled? So there is no, we've done several hundred hyperbaric and there is no ear damage. Okay, you just have a popping, when towards the end of the hyperbaric, you feel a little popping sound in the ear. There's a slight pressure in the ear. But we have some mouth exercises which we make you do before so that that pressure becomes less. Are these therapies under the same 5-day package or have to take them separately? No, so it's everything in the same 5-day. So in the 1 week, all of this comes together. Now you have an option of taking additional later, but all these therapies will be given to you in the first 5 days. Homnath Kendall, have you treated from donor cells for autism? What amount of stem cells is given at one time? No, we don't do from donor cells because we have got permission from our a government certified institutional ethics committee to only do from the patient's bone marrow. So right now we are not doing donor cells for autism. We are doing a clinical trial on donor cells for COVID. That's a separate project that is happening outside of this hospital, not here. But we do not do donor cells. We also don't believe that donor cells are more effective because the body tends to accept its own cells much better than cells from somewhere outside. So when I compare my data to the data of those doctors who are using donor cells, I find the patients we treat are doing much better than patients who have taken donor cells. In fact, we have many patients who have taken donor cells. I mean, they go to places elsewhere, Panama, Mexico, various other places. They don't show improvement and then they come to us. So that is why I'm not such a fan of donor cells. I believe cells from the body work better. Why is it up? Huh? One more time you went up. So Angel Nagpal says, how long do we need to wait for stem cell procedure if you're gonna do it, if you're doing, okay, no, you don't have to wait at all. Even if you're doing this here, you can come anytime. There is no, Angel, you don't have to wait at all. You can continue with whatever you're doing and we are going to not ask you to stop anything. So you can come the next week if you want. Nikhat Akshay says, hi, could you clarify when stem cells regenerate in the brain? Would there be a risk of something like over multiplication of cells in the brain? Okay, so we have, like I said, we've been doing this since 2008. That's 12 years. And we've done more than 10,000 patients, which is the largest in the world. And we have never, at least in 12 years, seen over multiplication of cells. Never. because these cells, they multiply, they convert into brain cells, and they disappear. You don't see them. If you go later, you're not going to see the stem cells. They have converted to brain cells, done their repair, and they're gone. And we are following up. In the very first patient I did of autism, we are still following them up. We are still studying them. And this has not happened in over 10 years. I don't think it'll happen now. What is the cost of autistic treatment? How do you receive it? So this is a medical presentation. So as a policy, I don't discuss anything about the cost or about the commercial aspects of this. So you can contact people in my hospital and they will discuss the cost with you. It's a matter of principle with me that in a informative talk, I don't discuss costing. But you're welcome to communicate, and people from our hospital will be very happy to give you all the information. We'll send it to you via mail, WhatsApp, whatever you want. It's just that I don't do it. I don't talk about cost. Amina Imam says, my son have autism and Phelan-McDermott syndrome. Can you help, please? Yeah, we can definitely help. So we've had patients with autism and different syndromes, like this one, and so we can definitely help. Yeah. So the Phelan-McDermott syndrome is something which is helpable with stem cells. Kranti Muparaju, can I bring my father for stem cells diagnosed with frontotemporal parietal dementia? Yes, dementia. So I didn't mention dementia because it's not published, but we've treated several patients of dementia and they do very, very well. And when we combine it with hyperbaric oxygen and ozone therapy, the results are amazing. We have people whose memory has come back and they're just so much more alert and fresh, and they have urinary incontinence which is gone. Their walking is better. So please bring your father, Kranti. You can bring your father, and the dementia with a combination of our treatments will definitely help. Anonymous says, thanks a lot for the information. Says integrative therapy like HBOT, ozone are covered in the 1 week program, or is it taken separately? No, the integrative therapies like hyperbaric ozone are part of the treatment. So it's all covered in the 1 week program. Yeah, so everything is part of it. Nikhat Ashfaq says, my son uses vagus nerve stimulator as part of M.Ch protocol. Will it affect the SCD process? No, not at all. Having a vagal nerve stimulator doesn't change anything. So we've treated several patients who have stimulators. So it doesn't come in the way of our treatment. Anonymous says, can I have a video appointment to evaluate how stem cell therapy will be helpful to him? My son is 7. We feel he's having less severity, autism, mainly behavioral, speech can follow directions. Yes, you can certainly have a video appointment. So somebody from our team is going to get back to you, and you'll be asked for a time, and then you can set up an appointment with me at a mutually convenient time, and then we can do a video appointment. That's part of the whole thing. So after the presentation, we do a video appointment. Alok Bhatia says, taking bone marrow and implant, all these steps take how much time? So the bone marrow, taking the bone marrow takes about 15-20 minutes, and then you have about a 4-hour gap between that while the stem cells are separated, and then implanting them takes another 15-20 minutes. Amina Imam, my cousin is 15 years old and has autism, no having seizures. Can you help? Yeah, we can definitely help Amina. The only thing is 15 years old, so he's past the optimum age, but he's still below 20. So he will definitely benefit. So yes, your 15-year-old cousin, especially since he has autism and he has seizures, so we'll manage the seizures with medicines, but his autism will definitely improve. Alok Bhatia, PET scan and all medical tests are done at NeuroGen or outside. So most of the medical tests, the EEG, a lot of things are done within NeuroGen. The PET scan needs to be done outside because we don't have our own PET scan. So some of the stuff is done here and the other is done very close by, and we make the arrangement. So you don't have to worry when you come here. We will arrange your transportation to and from the PET scan center. Angel says, what if I don't want to go for PET scan? Well, PET scan is mandatory because we have to document the improvements. Part of our approved protocol by our ethics committee. We have to show that there is brain damage that we are treating, because if the PET scan are normal, technically we are not supposed to shoot the stem cells. So a PET scan is mandatory. It's an important part of our treatment. Manoj Patel says, Doctor, is there any new advancement in stem cell therapy for improvement in LGMD? I went through stem cell therapy in 2014 NeuroGen, and there was not improvement or anything. So again, you have to understand, in muscular dystrophy, just slowing down, stopping the progress is good enough. That's what I said. So if you saw my lecture, if you heard the lecture, you showed the graphics. In muscular dystrophy, we stop the disease where it is. We stop it. We put the brakes on it. So if untreated, you would have worsened. If you remain same, that is an improvement for muscular dystrophy. Okay, for for autism, CP, of course, there are improvements. And now we have combined the integrative therapy and our recent results, combining stem cell rehab and the integrative therapy, the ozone. We are finding much better results and much better improvements because the integrative therapies have started about a year ago. Kadra O says, does this treatment help 13-year-old with severe autism and mito issues? Yes, it definitely helps. So your 13-year-old with severe autism and I think will definitely help. So yes, we can help them. Rajnikant Pal, my son is 2 years, 5 months. Is the right time for surgery? It's the perfect time. 2 years is the perfect time. The earlier we do it, the better. If we do it at 2 years, we can almost in a very short while reverse everything completely and can go back to a normal life. But I heard that you need to stop chelation 2 months before going for stem cells. Or not for, it's not for us. You don't have to stop, if you're undergoing a regular chelation program, of course, before coming, you will have to discontinue it because you can't continue it during that week where it is going on. But there is no need to stop the overall. When you go back, you can continue with your chelation. You'll have to stop it before coming. That's true, just before coming, but not 2 months before. Anonymous attendee says, does PET CT scan always show damage in kids of autism? Yes, every single 2,500 kids of autism, every single one had that. And like I said, we did it in some normal kids and not a single normal child had that. Was there any case where PET scan didn't show any damage and the kid was autistic? Never. We've never had a child with autism who had a normal PET CT scan. This will help us what SCT is trying to fix. Yes, exactly. So SCT will fix the damage in the brain. Then anonymous attendee says, my 5-year-old has low muscle tone. He walks on toes and falls a lot while running. And does SCT help for low muscle tone? Certainly it helps. We of course will have to, see the patient, see all the reports, come to an appropriate diagnosis, understand. But we've treated several patients who have low muscle tone because of various problems and we have been able to help them. Pallavi Joshi, how to talk to you one-on-one? Sorry, sir. So you'll get, all the people who've come here, you're registered, so you will get a call from us, and you'll get a call from us, and we will, I'll just find out what is the best way for us to contact, and but you'll get a call from us. Okay, so you can talk to us one-on-one. I just want to ask, how do you set up the one-on-one? Who will set up the one-on-one?
So, reception team will give the call and.
All right. So they just told me that you'll get a call from us and we will set it up for you. Yeah. Are there any advances in stem cell treatment recently? Yes, it's constantly improving. I mean, we are, the way the stem cells are separated, made, the machines, the technology, the equipment, all of that is constantly getting improving and is getting better every time. What we are doing, it's like a mobile phone. The mobile phone of this year is better than the one which we bought 2 years ago. So it's fundamentally the same stem cells, but the way they are made, manufactured, their things are much, much better with modern technology. What if we use the child's own stem cells? Well, we use the child's own stem cells only. We are not using outside stem cells. We are using the stem cells from the own child. Angel. Anonymous, how many M.Ch cells in the count of millions will typically be inserted as part of the procedure? Are there any other cells which will also be injected? So basically, this depends on the body weight. So the calculation is based, you've asked how many cells will be inserted. They are in millions, and the calculation is based on the body weight. So it is individual for each patient. Once we know the body weight, then we do a mathematical calculation and we get the exact number of cells. Anonymous attendee asks, in how many months we generally see the difference after doing SCT and therapy to decide on the next shot? How long will we have to wait to see if it is working? So from our experience, it takes about 3 months to start seeing significant improvements. Right? By 3 months, you start seeing good improvements. 3 to 6 months, you see the peak results. So it takes about 3 to 6 months. Ula Jumoke Afuwape asks, how do I book a one-on-one slot for appointment with the speaker? Please reach out to me at your address. Yes, so you will get a call from us, and we will set up a one-on-one with you. Nikat Ashfaq, any possibility that stem cells don't reach the brain? What happens to those in the spinal cord? Any complications expected? No, they all. So we've actually done a lot of work before, experimental studies, where you can track the stem cells through an MRI. You can attach a dye, and we have seen that all of them reach where the damage is in the brain. So they will not remain in the spinal cord, because we put them in the fluid in the CSF, and this CSF is continuously circulating. So the stem cells have to move to the brain. They cannot remain in the spinal cord. It's like fluid. The fluid is moving, so it has to move with that. Pallavi says, thank you for your response. Thank you so much, Pallavi. And I think with that, the question answer session is finished. If you have any more questions, feel free to ask, and I'm still available. Or you will get a call from us, and we will set up a one-on-one discussion with me. And so Iriza Musa asks, what is the age limit? Well, there is no age limit. There is only a weight limit. So the child has to be more than 8 kilograms of weight. There is no age limit. So the youngest child we've done is 8 months old. The oldest person we've treated is 82 years old. So there's no age limit. 20 is fine. Like I said, the older the child, the lesser are the results. But we can treat. At 20. The oldest autism I've treated is 38 years old. When I said 82, I was talking about dementia and stroke and other conditions. But autism, oldest I've treated 38, and we've had good results in that patient also. Yeah. All right. Any other questions, or we will call it a day? Thank you. Would be interested in one-on-one. So you will all get a call from us, and we will set up that one-on-one, and then we will take it forward. And I look forward to seeing you all in the one-on-one. Have a good evening, everybody, and have a relaxed weekend. Yeah, it's been a pleasure. Thank you so much. We are terminating the meeting. Thank you, everybody. Yeah.